Hi, my name's Kelli Pruitt, and I'm in the RN to BSN program at Bluefield State College. First of all, I want to say thank you guys for coming and taking the time out of your morning to be here. I really appreciate that. So today, our objectives are going to be to identify a goal of promoting oral health in long-term health care, identify objective of promoting oral health in long-term health care, identify 3 signs and symptoms of poor oral health, and list 3 interventions to promote oral health. So I want to start this project. It's a change project for our facility here at Pine Lodge because I felt like that oral care was something that needed to be addressed in our facility. So promotion of oral health in long-term care is what I'm doing my presentation on. You guys have a handout as well to follow. The goal and objective. The goal is to promote oral health in long-term health care. The objective is to create a mouth care guideline at Pine Lodge by developing and presenting a 15-minute presentation. A handout with staff and patient education will be provided so the program's change can be continued. Appropriate oral care tools will be provided to all patients upon admission and discharge. So I want to make sure whenever we're getting new patients in or admissions that we're providing them with an oral care kit, like their toothbrush, their dental floss, mouthwash. If they have dentures, that we're getting them a denture brush, a denture cup, the little denture tabs to put in the cups. Older adults, particularly ones living in long-term care, are among the most vulnerable members of society. Mild to severe health problems may be of concern in this age group. The aging process can be hard on the mouth, teeth, and gums as it is on other parts of the body. Assistance with daily oral hygiene is key to minimize health concerns and improve quality of life. So not only is aging hard on your body in general, but it's also hard on your teeth, your gums. Your bones can start to deteriorate and you have tooth loss. Some risk factors I want to talk about for poor oral care in older adults. The first one is dementia. That's a huge risk factor, especially here in long-term care, because a lot of our residents have a diagnosis of dementia. And with that, they can get confused and sometimes get combative and wonder why we're trying to do oral care on them. They could even try to bite you, and it's just very important to just make sure that you're re-educating them and reminding them daily why we're doing mouth care on them. Another risk factor would be if the patient's NPO are on a tube feeding. We do have some patients now that are on tube feedings and they can't have anything by mouth, and it's very important that we're performing oral care on them daily, at least every 2 hours, keeping their mouth moist, providing them with the lip balm that we have here in the facility, making sure their lips don't get dry and cracked. So those are huge risk factors for poor oral care. Another one is medications. A lot of medications, the side effect is dry mouth, and whenever you have less saliva production in the mouth, you have a buildup of bacteria, which causes plaque and buildup on the teeth, and it can decay them. So you want to make sure that after they're getting their medications, especially for crushing them up and putting them in applesauce, that we're giving them good oral care so that applesauce and those sugars aren't laying on their teeth and their gums. Another risk factor would be lack of education. That's huge. I know in West Virginia, it seems like a lot of people don't take care of their teeth. And I think a lot of it is from lack of education. Maybe their parents didn't teach them when they were younger, so why when they're older are they going to start taking care of their teeth? So it's important that we're teaching the patient, the family, and even the nursing staff. Some nursing staff don't know the importance of education with oral care. A few signs and symptoms of poor oral care in the older adult that I want to talk about. The first one's tooth decay, and as you can see, there's a picture there. You have the normal tooth. Then in the middle picture, you see the tooth has a little spot on it where plaque or buildup has started laying and decaying the tooth. And then the third picture, you have a full-blown dental decay or cavity. And those can be very painful, and they can cost a lot of money. They can lead to root canals and cost the patient more money than what needs to be. It's a quick fix if we can catch it early. Bad breath is another sign and symptom. If you go into a patient's room and their breath smells horrible, it's probably because they're not getting good oral care. So we want to make sure that we're brushing the tongue, getting the gums, the whole mouth, as a whole, that we're providing good oral care to prevent bad breath. And like I said, when we're crushing up their medicine in applesauce and then it lays on their gums and their teeth all night, and then they wake up in the morning and they talk to you, their breath is horrible, that's probably what it's from. So we need to make sure we're giving them good oral care. And then another sign and symptom would be increased oral pain. Like I said, cavities can be very, very painful. So if we can get to the problem before it becomes a huge issue, then it's an easy fix, and it could, prevent having the tooth completely pulled or having to have a root canal on the patient. Some interventions I want to talk about to promote oral health in older adults is we want to educate the patient, family, and staff. Like I said earlier, staff is a huge one because I don't think that we have enough education in the facility on oral care. And I think sometimes it gets swept under the rug or it gets forgot about, put on the back burner because we're so busy cleaning them up, making sure they get fed, that oral care is not a high priority. And I feel like that it needs to be, because bad oral health can lead to other health concerns, which I'm going to mention in a little bit. Another intervention is we want to provide oral care tools. You can come in. I don't know if you guys noticed, but at the beginning of my project, I believe it was you that I talked to. I wanted to know why you thought that oral care wasn't getting provided in the facility, and it was mentioned that these old cheap toothbrushes that we had, the bristles were falling out in the residents' mouths, and they were getting caught up in their teeth, and that they didn't want you to finish performing oral care on them. So what I did is I got with some of the higher up people, and we got these new toothbrushes ordered, and they're a lot better. The bristles are a lot softer. They stay in the toothbrush. I don't know if you guys have noticed.
Yeah,
these
they're
are
a lot better.
Good. Okay. So that's a good thing. And then another thing that I got is dental floss, because we have a lot of younger patients coming into the facility. I know we have one that's around my age right now, and I couldn't imagine having something stuck in my teeth and not being able to get it out. So these are the new dental floss things that I got provided for the facility. So like I said, interventions would be, we have to have the necessary tools to even perform oral care. The next intervention would be to collaborate with the healthcare team, including the dentist. I think a lot of times setting up an appointment with the dentist when the patient comes on admission, it gets put on the back burner because, like I said, it's not as important as other appointments, maybe cardiac or other appointments that they need to go to. So we need to make sure that we're collaborating with the dentist as a whole. And I want to mention too that CNAs, LPNs, RNs, we're all just as responsible for oral care. It's not just on the CNAs. We're just on the LPNs. And then the next intervention, we want to follow mouth care guidelines per facility. We have to make sure that we're following our policy and our guidelines here at the facility, or we could get into some trouble, some sticky situations. So you want to make sure that you're checking your Cardex, the care plans, ask the nurses, make sure that we're following protocol. The next thing is we want to identify 3 advantages of proper oral care in older adults. The first one, we want to minimize medical problems and improve quality of life. That's an advantage. If you're giving good oral care to your patient, you're going to minimize other medical problems and improve their quality of life. And there are some things, I have a handout for you guys. It's the one that says gum disease is linked to, and I want to talk about a few of those things real fast. The first one, I don't know if you know, but poor oral health is linked to diabetes. It's an increased risk for infections, including gum disease. Oral infections can increase diabetes by increasing blood glucose levels, leading to other complications such as with the eyes, the kidneys, the nerves, and the blood vessels. Poor oral health also can cause heart disease. Gum disease increases risk. Bacteria causes inflammation, and periodontal disease can increase inflammation levels throughout the entire body. Another one is pneumonia. Microorganisms and pneumonia also found in dental plaque in elderly with gum disease. Malnutrition, pain, discomfort, and tooth loss can lead to poor oral intake of food and drink, leading to malnutrition and weight loss. That one to me is huge because I know that in the past we've had some weight loss in the facility, and it never dawned on me that it could be because maybe they're having oral pain from like a bad tooth or something, so they're not wanting to eat and chomp down on that food, so now they're malnourished and they're losing weight. So it's very important that we're giving them good oral care because it all starts right there for them to eat and be getting what they need. Another one is osteoporosis. I think this one is very fascinating. It's one of the most common bone diseases characterized by decreased bone density and weakened bones. Bone metabolism and oral health go hand in hand. Early signs of osteoporosis can be seen in the mouth and detected through oral examination and dental x-rays. And if you think about it, we have bone in our mouth. So if we're going to the dentist at least once a year, then whenever they're checking and they're doing x-rays, they could catch that you have osteoporosis just through looking at your mouth, which is really cool.
Yeah, that's crazy.
Yeah. And then I wanted to mention this. Less saliva production increases the risk for tooth decay because saliva helps keep harmful germs in check. Even if the patient has no teeth, it's important to perform oral care daily. So even if they don't have teeth, you still need to get a soft bristle toothbrush. Make sure you're brushing the gums, massaging them, making sure that you're assessing inside the mouth for no sores or anything like that. And if they have dentures, that you're checking to make sure they're fitting correctly. Because like I said, all of these things can relate back to, you know, having other problems like malnutrition, etc. Some key notes here. We want to make sure that we're updating the care plans. Nurses need to make sure we're keeping the care plans updated per the patient's needs. We need to make sure we're also updating the cardexes. CNAs, you go by the cardexes, and that's where you find how often and when you're supposed to be performing oral care. You want to supply the admission and discharges with oral care kits and supplies and collaborate with the dentist for any exams on the patients yearly. And then, like I said earlier, make sure you're always following guidelines per facility and policy. Okay, and then I also have a handout here, and it has mouth care guidelines. I'm going to read through it real fast. So these are pretty basic, but I think they will be good for our facility. The first one, you want to provide the resident with oral care kit and tools on admission and discharge. Brush teeth, gums, tongue at least once a day with a toothbrush with soft bristles and toothpaste as the resident will allow. You want to clean between the teeth once a day with floss as the resident will allow. Rinse with an antiseptic mouthwash once a day as resident will allow. Cleanse full or partial dentures at least once a day by soaking in cold water with denture tab and cleansing with denture brush, and provide oral care as resident will allow. And it's also best to remove dentures at nighttime. That's the best time. If you're not doing it more than once a day, if you do it just once a day, make sure it's closer to nighttime so that those dentures can soak. And also, I don't know if you guys know or not, but if you line the sink with a towel, that way if you do end up dropping a denture, it's not going to break and cost the resident more money. NPO residents, we want to moisten and cleanse the mouth at least every 2 hours. That's very important. Make sure if they're NPO, they're going for a procedure or they're on tube feedings, that we're doing mouth care every 2 hours on them. You want to provide facility lip balm for dry lips as needed or requested by the resident. You want to promote non-smoking facility. We are a non-smoking facility. We want to encourage and assist the residents with smoking cessation. You want to visit the dentist yearly or more if indicated. You want to provide the residents with a healthy diet. Document oral care provided in the ADL book. So make sure that after you do your oral care that you get it documented. So that way whoever comes behind you will see that you did it, or if you didn't do it, then they'll know that they need to pick up and do it, because we need to at least be doing oral care once a day. Because I know when I looked in the cardexes, everybody has something different. Some people say twice a day. Some people say twice a day in PRN. Some say just PRN if they don't have teeth. So what I want to get going in our facility is making sure that we're at least doing oral care on each resident once a day. Very, very important, guys. We want to make sure we're Always following our Cardex and care plan, and then report any complaints of oral pain, discomfort, lesions, sores. If their dentures are causing sores, you want to make sure that you're going to the nurse, and nurses, you want to make sure that you're reporting it to the physician. I have a picture here of the supply room that has our oral care supplies. So if we have a new employee come into the building, you can show them where the materials are so that they can give good care.
Kelly, I know a couple months ago they used to keep Biotine like in the back, and do they still do that? Like they used to keep it in the med room, and we had to ask for it. I don't know if they do.
I think we still do. We keep it in the med room, so you'll have to ask the nurses.
Okay.
Okay. Do you guys have any questions? Do y'all feel like this was a good in-service?
Yes.
Did y'all learn some things?
I did not know that about the osteoporosis. Like,
yeah, that's pretty cool.
Yeah.
So, okay. Thank you guys so much.